All right, good afternoon, Special Olympics Kansas and athletes and Dr. Gaffney and our CEO, John Lair. Welcome to Virtual Health and Fitness on Thursday for Community Involvement Thursday with Dr. Gaffney. She has put together a really nice presentation for you athletes. Today, she's going to be talking to you about transitioning to your adult healthcare life and also creating a medical notebook, which I think is going to be so helpful for you and your physician whenever you go to see the doctor. Because when you go see the doctor, you're going to be feeling really terrible, you're going to be feeling really sick, but having that medical notebook with you is going to be such a huge help for you and the doctor. So today, we're going to start off with our question that Luke Pratt has come up with. It is, what is your favorite breed of dog? So we're going to start with Seth. Go ahead.
Hey guys, it's Seth. I am also a health messenger. I'm also partnered with Special Olympics on Twitch, so I do raise money for Special Olympics. And you can find me on Twitch at twitch.tv, Sean the Gamer 12.
What's your favorite dog?
My favorite dog has to be Golden Retriever.
Golden Retriever, all right. Go with Airbud, I like it. Kaylee.
Hi, I'm Kaylee McLaughlin. I'm an athlete in Illinois and a health messenger in Illinois. My two favorite kind of dog breeds are Chihuahuas and Pit Bulls.
Thank you, Kaylee. Becca?
Hi, my name is Becca Henderson. I'm a health messenger and a golden messenger. And my two favorite kinds of dogs are wiener, like dachshunds, and rat terriers.
Very good. Thank you, Becca. Carrie?
Hi, my name's Carrie, and my favorite dog is a Yorkie.
Nice. Thanks, Carrie. Carol, are you there?
Yeah.
What's your favorite dog, Carol?
Bulldog.
Did you say all dogs or old dogs?
Bulldog.
Old dogs. Oh, boy. All right. Luke, go ahead.
Hi, I'm Luke. I'm a health assistant. I'm with my hand Special Olympics, and my favorite dog is German Shepherd.
Very good. Miss Ashley Lilly.
Ashley from Slana, and I like Chihuahuas.
Very good. Thank you, Ashley. Ashley, this is, I believe, either your first or second time ever getting on with us. Can you tell the athletes, what sports you play and anything about yourself?
I do basketball, volleyball, track, swimming, and tennis and bowling.
Very good. Thank you, Ashley. Brandon.
Hi, I'm Brandon Gift. I'm a Special Olympics New Jersey athlete. I do swimming, bowling, cycling, and I also am hoping to do floor hockey. I'm also trying to become a global messenger. My favorite dogs are cockapoos and boxers.
Awesome. Thanks, Brandon.
Hey, Jess, what's your favorite dog? What's your
My
favorite
dog? I think I'll go with Seth. It's a Golden Retriever because I love Airbud. It's awesome. Thank you, Luke. Mr. John Lair, would you like to introduce yourself?
Sure. John Lair, President, CEO from Special Olympics Kansas, and my favorite dog is a Basset Hound.
Awesome. Thank you. All right, Dr. Gaffney, tell us about you. Tell us where you're from, what you do, everything about us or about you, and then tell us what we're gonna do today.
Okay, well, my favorite dog is actually a mutt. I just like mutts because I think, they're kind of a good mix of everybody. So that's my favorite dog is a mutt, but not too big of a dog because I like a dog that can sit on my lap. So if they're like 100 pounds, that's too big. Okay, and so I am here in the Kansas City area, and I am a doctor that did a little bit different kind of a training program after I finished medical school. And I did both pediatrics and internal medicine. And that means I can see everybody of all ages. And really one of my very big interests is adults with special needs. And so, what is a person with a special need? It means that they had something that started in childhood that's going to last their whole life and impact their health in that way. So like if you have a heart attack, most people don't have that when they're a little kid. They have that when they're an adult. That's not a person who has a special need. So you can have a special need because you have a physical need, or you have an intellectual need. You have a genetic need that's different. And I try and service those people, but I've actually been in practice as a doctor a very long time, 25 years this year. And so I have seen people of all ages and done all kinds of different things, but always been here in Kansas City, even though I'm originally from St. Louis.
So, very good. Thanks,
And
Dr. Gaffney.
I have one other special thing, which is that I actually came in third in the state in bowling when I was in high school.
Nice
So
job.
there we go.
Thanks, Dr. Gaffney. All right, I'll pull up your presentation for you real quick.
Okay.
There you go. And then just let me know when you're ready to change a slide.
Okay, so I'm going to talk a little bit about, and most of you look like you're already adults, but that's okay. Maybe you can share it with people who might want this information, which is transitioning from your childhood doctor to your adult doctor, okay? And also, sharing that with, people who are either going to start doing that or their parents. So this is a pretty important topic for a lot of people. Okay, next slide. Can I just move ahead myself? Okay, so that's me. I run the SPAN, which is Special Pediatric to Adult Need Program here at our hospital at Advent Health in Shawnee Mission. And that kind of talks about me. I already talked about me a little bit. And I've done a whole bunch of other things. Basically, I've worked with babies, I've worked with kids, I've worked in the hospital, I've worked outside the hospital. I've done all kinds of different jobs as a doctor, but almost all of them centered right here at Advent Health. So I talked a little bit there. Oh, wait a second. Let's go back. There we go. Oh, there we are. Stop right there. So a little bit, my mom was not technically a special needs person because her disease started when she was older. She was about 35 years old and she had multiple sclerosis. But because of that, she developed into quadriplegia. So she could not walk. She first became a paraplegic and then a quadriplegic. So I do have a pretty good idea of what it's like to have to use the restroom when you are a person who's in a wheelchair, and how to transfer from your bed when you're someone who's in a wheelchair. Or, kind of one of my big things that we've done here at our office is that most primary care or specialty offices don't have an exam bed that allows a person with special needs to be fully examined. And so we got a bed that can lower to 17 inches that people can be lifted on and lifted off, so that it makes it easier to truly do a physical exam, because a lot of people will be never examined outside of their wheelchair, which is just not appropriate. And, my dad, he had a lot of resiliency. He grew up in an orphanage, but then was able to get an education and, did pretty well. My grandma at the time, okay, we're talking about the 50s, 60s, and 70s, they used to not call people with special needs or Special Olympics. They used to call them crippled people. So the terminology has really changed, but she was a librarian at the school for what they called crippled children. So some of those children had cerebral palsy. Some of those people had Down syndrome. Some of those kids had been affected by polio. And then my grandpa, who was just a hard worker, but a lot of fun. Okay, next slide. So, and I think these are just some of the things that I have gotten out of a world of working with people with special needs, which is that you just can't let the world define you by the way you look. It's very important what's on the inside and your attitude. Go ahead. And why is there such a problem for people who have special needs? And I kind of outlined that a little bit, which is, what is a special needs individual? And again, is it a genetic problem? Is it a developmental problem? Is it a physical problem? Is it an intellectual problem? It's a very vast, and it essentially is a disease or disability that occurs in childhood that will exist throughout your entire life, meaning it never goes away. It may get worse, it may be progressive, but it never fully goes away. And there are a lot of subspecialty clinics, like there might be a clinic that sees people once a week with Down syndrome or once a week who has cerebral palsy. But there are very few primary care clinics that serve adults with disabilities in the United States. However, this is a very important need because over 500,000 special needs individuals enter adulthood every year. 1 in 4 adults lives with some sort of disability. 50,000 individuals with autism enter adulthood a year in the United States. 6.5 million people have intellectual disabilities, and Down syndrome is very common. And in fact, 500,000 people in the US manifest 1 or more symptoms of cerebral palsy. And kind of one of my big things is that the Americans with Disability Act, they provide a lot of guidance for people, and they talk about what it is to have, handicap accessible toilets, handicap accessible jobs. But you know what? There isn't anything that outlines what it is to have a handicap accessible healthcare. And so there isn't any definition for a handicap accessible medical office. And that is one of the things that I really want to try and change. And also tell people what they deserve to have and ask to have so they can be their own advocates in that. Okay, next slide. Okay, so how do you find a new doctor? And again, most of you are already adults, so you're really not going to ask your pediatrician because most of you are beyond that. But you can, because sometimes people's pediatricians are seeing them till they're 30 years old, which is fine. You can also ask maybe a very trusted doctor who's maybe your neurologist or your psychiatrist for someone who can help lead you in the adult world. Sometimes you can contact your insurance company or Medicaid or Medicare to get a care coordinator. They will sometimes have insight into who is seeing a lot of people with special needs and link you up to them. And then you also want to find out how long or what age your physician will see a patient. So sometimes you don't have to transfer. Maybe you're seeing a family physician who can see you your whole life and you don't need to change. You can also ask for, well, you're already on Facebook. We're talking about that today. You can also ask some specific support organizations. For instance, like the Down Syndrome Guild, which is actually like 10 minutes away from my office, and they will have some resources to assist people in finding physicians who understand, know the updates, and can connect appropriately, not just medically, but socially, emotionally, with people who may be facing different kinds of challenges. I already talked about transitioning and Medicaid to talk to a caseworker. And again, I talked about, do they have a way to have a handicap accessible bed or scale available in the clinic so that you can be weighed or examined appropriately? And a lot of places don't have that. Next slide. So there's a lot of information about how to transition, but some of it is very disease specific, and that can be, there can be a lot of repetition in guidelines. So, because a lot of times people may have more than one category. And so going to the disease specific transition site can be very difficult, very confusing, because you're like, okay, this one says this one says that. So there are some core ideas that are in gottransition.org, which are good. You can also, and I've got a couple pages in here just with some examples of specific guidelines for adult care, and to make sure that your adult care provider knows what those are, understands them, or at least has the idea of how to get to those guidelines. So again, there's some information there about the Global Down Syndrome Foundation, the Cystic Fibrosis Foundation, and we have a couple pictures on that. You can also ask a medical librarian at your local hospital to help you find correct guidelines and do research. So a lot of people say, well, I just looked on the internet. Well, the internet doesn't mean it's scientifically sound, that it's safe. And so you can ask a medical librarian at a hospital. There's libraries at almost every hospital and someone there to help you. And you can ask them to help you get information so that you are safe. Okay, next slide. So again, this is just kind of an example sheet. I just picked two of them. One is the Adult Care and Cystic Fibrosis Checklist, but a lot of places, if you, there are certain guidelines, and most organizations will give a listing of a checklist for some basics, like, okay, these are the basics that everybody should have. So that's just an example of cystic fibrosis. And the next slide is a link that is for medical Down syndrome. I see from Twitch that I'm cutting in and out. So I'm going to sit real close and you're going to see my head as a giant. Okay. I am, okay, next slide. Next slide. There's a few special tips that I suggest, just because some things are more easily covered when you are a child than when you are an adult, which are things like getting a new wheelchair. So there are specific guidelines once you reach adulthood that a wheelchair is only covered maybe once every 5 years. So it's really important to try and get that new wheelchair maybe at age 20, so you've got it for your adult sized body. Also, a lot of people have what's called sleep apnea, and that's more common in some diseases. And so again, it's easier to get a sleep study. Sometimes it's very hard to find a dentist that will cover that you can see or that you can get along with. And so it's important to try and find a dentist that can offer an anesthesiologist. So if people feel really anxious about getting their teeth cleaned, or if they have to have a dental procedure, then they can find someone who can work with them. Also, it's very difficult to find a physical therapist that can work with adults with disabilities. Not all of them do, even though it says, oh, go see this physical therapist. Some people don't have the personality to work with adults with special needs. Some people don't have the medical skill to work with adults with special needs. I had listed just 2 in the Kansas City area that we use, and I think Ability KC comes out into the Lawrence area as well. It seems kind of strange, but to qualify for certain supports, you have to have your diagnosis, even if that's autism or ADHD, or you have a dyslexia. You need to have all of that testing done before the age of 21, because most insurance, Medicaid, Medicare, do not pay for any of that testing to be done after the age of 21. And then you also have to have a specific behavioral developmental pediatrician consult to be, quote, diagnosed with autism, or that you can't get supports for that. It's also important to start looking for day programs at around age 18. I also recommend people get all of their immunizations completed by age 21. And it's also going to be harder to get everyone to communicate. Now, it sounds like a lot of you are good at self-advocating, but people need to learn to be more their self-advocates in their healthcare, and their primary care doctor is to be their guide and their assistant in a bigger role usually than they were when you were using a childhood physician. So the other thing I say is that your new doctor, your new primary care doctor is not the psychiatrist. And so if you have seen a behavioral pediatrician or pediatric psychiatrist, make sure you get a referral for one prior to transitioning, because it's very difficult to find one. Sometimes there's a very long wait list. And again, not every psychiatrist is going to have the personality or the medical knowledge to work with special needs people. And so it's a good idea to get a referral from your pediatric or your previous doctor, because they're going to know what's going on in the community. All right, next slide. So one of the ways I think that people can advocate for themselves is to make themselves a medical notebook. This is not the notebook that people have at a group home. This is not a notebook like a medical record like a doctor has, because it needs to be in some ways much more efficient and much simpler. So I have people get a 3-ring binder, an old-fashioned paper with some clear pages so they can take things in and out, okay? And it's divided into sections. And this way you carry that notebook to every doctor appointment that you go to, so there is less confusion, because in the adult world, not everyone is in the same hospital system. You may not have the same pharmacy for all of your medications. You may have some that go to a send-away. You may have some that go to a specialty. You may have some that are local. And the tough part is, even if you have Medicare or Medicaid, then every year, how the state or federal government divides up the contracts changes. So unfortunately, you may need a feeding tube and you may need tube feeding, but this year it goes to Clock Medical, next year it goes to Apria, the following year it goes to somebody else, and you could potentially have to change providers for CPAP every year. Okay, next slide. So the first section of your book, hold on a second, I'm going to take a quick drink. Okay, thank you. Is really just the simple things, you know, like your own personal information, who's your emergency contacts, who's your caseworker, if you have a DPOA, which is your power of attorney, or who's got your guardianship, or if you're your own guardian, you know, just, you know, your home address, phone number, that kind of thing. Next slide.
Hey, Dr. Gaffney, I was just going to mention that we do have a couple athletes who have notebooks and are writing things down. So if you need to take a moment to write stuff down on a slide, please let us know, okay? And then
Yeah,
Dr.
and
Gaffney,
I have no problem. You can share these slides with anyone.
Perfect. That was going to be my next question. All right.
Yeah.
Next slide.
So they don't have to try and keep up with everything. They can just have a copy of this.
Yeah.
So the second section, which again is why it should be a clear notebook, clear pages, because the medications are going to change a lot. And every time you go to your primary care doctor, you should say, print me a new copy of my medications before I leave today. So it's got the correct dose. You also want to put on there who is prescribing each medication. Okay. You don't need to keep every copy of the medication list. Okay. You get a new copy, you shred the old one. You get a new copy, you shred the old one. You don't need to keep every single copy of every medication. Okay. The other thing is that it's a lot of times it is very nice to go in person and speak to a pharmacist. So a pharmacist, because I'm very familiar with pharmacists, if you look behind my head, that picture right there was a painting in my parents' store. They were both pharmacists, okay? And they want to help you be safe. So it's important because you may have lots of different doctors and they're prescribing medications that can interact, or you can have allergies. And so it's always important to ask the pharmacist, hey, will you look at my medications for me? Are there any problems with this that I need to know about? Okay, next page. Section 3, let's talk about allergies. You keep that on a separate page and you just add them. So I want to talk about the difference between an adverse reaction and an allergy. Okay, so an allergy, or what we're really concerned about in healthcare, is what's called anaphylaxis. And anaphylaxis means life-threatening allergic reaction. That means you stop breathing, your body is covered in hives, your tongue swells, or your skin falls off. Okay, that is considered a severe allergy. If you just get your tummy upset, that's not an allergy. You can say it's an adverse reaction. Okay, but anything that is not so severe that it takes you to the hospital or your doctor's office is probably not a life-threatening allergy. And there's a difference. So if you have a true severe allergy, then like you stop breathing, something has happened to a medication, you need to have an emergency rescue plan. If you don't have that emergency rescue plan, but something like that has happened to you, you need to talk to your doctor about that. Also, if you've had what you consider an allergy or an adverse reaction, you need to put on there what happened, when did it happen, etc. Because a lot of people confuse adverse reaction and allergy. But to me as a doctor, I want to know about the adverse reactions, but I don't consider those allergies. Does anybody have a question about that? Because that is sometimes a very confusing.
Yeah, I have one.
Yeah.
I'm in New Jersey, and I know with like bee stings and different stuff, but an allergist office and all, and they gave me an EpiPen. I've yet to use it, but thank God I don't have to, because it's unless it's emergency. So I know that's one of the important things.
Right, that's a true allergy. And so it's important that if people have had a true allergy, they know how to use their EpiPen. And that the group home, if they're living in a group home, that the group home has one.
Mm-hmm. Well, the other question is, when they say when you're done with it, you bend the sharp edge, does that mean that it's done and you have to get another one after that if you ever use it?
If you use it, you need to throw it away. You never use it again. Okay. Now, people worry about what do they do with needles. Now, I'm going to tell you, I happen to have a cat that's diabetic. I have to give insulin to him. Okay. After we're done, we have to slide the cap on there again. And then I just put it in a milk carton so that there isn't sharps going out into your trash, because that's just dangerous to people. Okay. So you don't, or you can always take a used pen back to your doctor's office and they can dispose of it. Okay, and I think Mr. Pratt, you had a question, but unfortunately I don't know your first name because it comes up as Diana, which is not you.
My name's Luke.
Okay,
I have allergies to spraying because it stuffs my nose up every time. It makes me having trouble sleeping. I end up with my mouth open.
Right, so that's important, but that's not allergic to a medicine. It's an environmental thing. So I would say you're allergic, but are you going to die from exposure to oak?
No.
Do you need to have an EpiPen? And the answer is no. So it's just really important that, because sometimes people say they're allergic to this antibiotic and that antibiotic, and it's not that they're allergic, but they just had an upset stomach. But there might be a time in their life they really need that medicine to save their life. And so it's important to be very specific about what happens to you in your allergy. Okay, are there any other questions about that? We can go back and talk about questions about everything else later, but this is kind of a important thing. Okay, next question, next slide.
I was just gonna say, if you guys if anybody has a question, I would say use the reaction hand. It's more helpful. So we know who's wants to talk first instead of just
okay. Okay, so these are some of the other things. So the next section would be birth and perinatal history. So this, and you know what, some of you may not know this. You got to go back and ask a parent or somebody who's been in your life a long time, which is, how old was your mom at the time of birth? How many pregnancies, deliveries, and live children? How gestational age means how many weeks along in a pregnancy was your birth mom when she gave birth to you? How much was your birth length and weight? And then writing, because this is not going to change, right? I mean, you're adults, this isn't going to change, but a person who is really truly interested in understanding what is going on with you should ask these questions. And if they don't, you still got to give it to them. It's be like, do you know what this means? Do you know what this means? Because those are the things that influence who you are today. This is important. So these are the kind of questions that I ask a person when they first come for their first visit. Okay, how old was your mom? How many pregnancies? Maybe you were the only child she was able to give birth to and she was pregnant 10 times. Okay, well, that tells me something about mom's health. What happened there? You know, just asking a lot of questions. Next slide. Okay, so section 5 is surgeries. Most of the time, people just add those on to their list as time goes by. Have they had eye or ear surgeries? Did you have to have a surgery prior to getting glasses? Did you have your appendix out? Sometimes it can just be simple surgeries like hernias or, you know, something simple. But did you have any major corrective surgery immediately around birth that's not explainable? Or do you have anything implanted in your body? Okay, so some people may have a corrective heart pacemaker. They may have something to help them with back pain. They may have a baclofen pump. Those are all surgeries and they need to be noted. And also when, I didn't put this on there, but when they happened, approximately. You know, we as physicians, we don't care that it was October 17th of 2000, okay? We care it was 2000, all right? We don't have to have the exact date on a lot of those things. We just want to know kind of approximately, or the month. But if you don't have the exact date, most of the time that's okay. All right, next slide. So medical problems, I say every detail is important, but you don't want to just throw everything on there because that's just too confusing and then you lose track of what's the most important thing. So you want to put the most important thing, the thing that is most affecting your health at the top, and then work your way down to the least important thing. Like for instance, I'll just say me, okay? I'm pretty healthy and I wear glasses. So I'd probably, you know, my vision, I need glasses to drive, but that's not the most important thing in my life. That would probably be the last thing I have, okay? Now, what the heck is an ICD-10 code and who do you care about that? That is basically the way the government and insurance explain in a number a word. It's pretty confusing. But let's say there's one I know off the top of my head. Moderate recurrent major depression. That translates to the government to F33.1. And you're like, what the heck is that? But the reason to care about that is that it actually tells your insurance, your Medicaid or your Medicare, if you are a sick person. That sounds weird, but each of those things is scored. And this is all happening behind the scenes. It's not anything I'm doing as a doctor, but that may help you be able to say, hey, I am sick enough that I deserve some services. And it's really strange because like saying you have insomnia doesn't count. Saying you take something to help you sleep, which is a sedative, that counts. Also, even something like saying you're incontinent, that doesn't count. But if you say mixed urinary incontinence, that counts. It's just bizarre. I don't make the rules, but I'm learning how to play the game, so to speak, so that my patient can get the services they need. I can't get diapers for people who are incontinent if I say they're incontinent. I can get diapers for people if I say, hey, they have mixed urinary incontinence. So it seems like a weird thing. And guess what? Those terms change. That's what's hard. And again, I think it's important maybe once a year. Obviously, you want to just kind of keep that list in there and add stuff, but then have your primary care doctor update it visit it and go over all that once a year. Okay, next slide. Section 7 is basically family history. That's not that hard. Basically, you want to put down your birth mother, birth father, siblings, half and full siblings, the grandparents, and kind of identify what they died from, what medical problems they had, what kind of cancers they had, and just keep that organized as life goes by. Okay, next slide. So this is something that, again, you don't need to keep every single test you have done your entire life, but you want to keep maybe the first set of your cell count, your kidney liver function, and your cholesterol as a baseline. And then the most recent one, you don't have to keep every single one of them. Thyroid, just so again, you want to clean it out every year so you don't have to keep every single thing all the time, because you'd end up with this huge notebook of nonsense material you don't need. But there are some things you really want to keep: every pathology report, every biopsy report, every genetic report, any kind of thing which is called an EEG, which is like a brain map, any heart studies. And again, you want to keep the more rare radiology studies. You don't need to keep every single chest x-ray or every single finger fracture information. You don't need that. But, the things that are more rare, that's what you need to keep. Okay, next slide, please. Again, it's important for you to keep, you're thinking this is a big notebook. Well, it kind of is, but once you get going, then you've got it. Which is to keep a list of your past and current physicians, nurse practitioners, your therapist, physical therapist, mental health therapist, the hospitals that you visit. Try and have the phone address and what is their specialty. That may not be possible, but sometimes at least you can list Dr. Smith, ear, nose, and throat doctor. That way it's easier to remember who you saw in the past. So do you all know what a DME is? That means durable medical equipment. So that can be like if you have sleep apnea and you have to wear one of those machines, that can change again every year. So you may get a CPAP machine with one company, but you need it renewed in 3 years. And guess what? Your insurance or your Medicare provider says, sorry, you can't go there anymore. So you've got to keep that organized and then know what your settings are or how much your pump is, or if you've got a feeding tube, what are the equipment that you need and how much do you keep of it? Okay, so that you've got to kind of keep that in the book. Next section. Next slide, excuse me. And then that's me, and that's where I am located. That's my office here. Like I said, theoretically it's Miriam, Kansas, but you could call it Shawnee Mission, you can call it Overland Park, whatever. So what I'm going to sign off now. I think I've seen most everybody's chats so far. And I'm going to be open to questions. And I think, Jesse, you can probably moderate, okay?
Sure. All right, athletes, do you guys have any questions? You can raise your hand on the screen, or we can do the chat, however you would like to do it. Go ahead, Becca.
Can Mrs. Guffrey or Dr. Laura, is
yeah,
it okay?
this is fine. Call me Dr. Laura. That's fine.
Okay. Can Jesse email like those the information for like every from your slides today, so that way we can like write them down, and then like if that's okay with you?
Yes, that's perfectly fine with me.
Okay. Thank you.
I'm gonna write that
And
down,
I
Becca.
guess the only question I had was when I travel a lot, I have the My Chart app. I'm here in Jersey, so they have like Virtua and Cooper and different ones. If you travel the country, such as Kansas or Florida, I know they have like Advent Health. does they take Medicare, and Horizon New Jersey Health does insurances if I had to go there?
Okay, well, everybody takes different insurance, but Medicare is accepted just about every place. The problem with my chart, and it's great that we have electronic records because we can take that with us. But unfortunately, most, each system is different, so they can't communicate very well. All right. And plus, most people are carrying around a phone, that's this big. And like, I'm 52 years old. I can't read that tiny print of a radiology procedure. And remember, your My Chart, the problem with electronic records is there's a lot of stuff in there, especially like when I get a transfer of records from people, that has no importance at all. It'll send me every instruction you've ever been given as a patient. And I don't need to know that because I'm a doctor, and I don't need to know you may have stomach upset with your medicine. Yeah, I know that. So there's too much junk in the electronic systems that are not pertinent. And so that's the point of you being in charge of your own record, because they're not going to communicate together. They can't transfer information, absolutely. And part of that is not to be difficult. Part of it is that they're trying to maintain some personal privacy. I mean, I don't know what's going to happen if we're going to end up going to unified medical records across the nation as time goes by. I don't know. So, I mean, part of it is they're competitors, and part of it is there's privacy issues. And that way you are just what I call, you have the meat and potatoes of your medical records. The most important stuff you put in that book. Everything else doesn't matter so much. It's not going to help you in an emergency. You just need the meat and potatoes.
I love that. Yes. Yeah, because Dr. Gaffney, I used to work in the emergency room as a medical scribe with physicians. And like you said, like on an electronic medical records, athletes, when we look at the computer, everything is there. And there's so much information that it kind of overwhelms, and you're sifting through it and you're like, what's pertinent to this patient and what's not? And then also, like Dr. Gaffney said, when you go to a doctor, there's a lot of different types of doctors out there in the world, and their electronic medical records don't talk to each other, and it makes it really difficult. So if you go to a hospital here, your family physician may not be able to read that. And so having a paper medical notebook and having, all of your up-to-date stuff in there. So, throwing out old medications and, like Dr. Gaffney said, putting in those new medications can really help speed up the process and improve your healthcare significantly. So it's so much easier on you and the physician to try and remember what's real for you and what's old and what's changed, what's new, and that kind of stuff. So it's always best to have paper in healthcare right now.
And that seems strange and old-fashioned. It really does. It doesn't mean that you can't put all that in your own computer system, okay, and kind of make your own file, obviously on Word or something like that. But then you have to be able to scan documents yourself. So that's going to be harder. You're going to have something to be able to scan, upload, etc. So, I mean, if you want to do that, that's fine. And that way you keep your own computer copy, but it's good that you can just bring it in and hand it to someone, because you're probably not going to bring a whole laptop into your doctor's office. And again, the print on a phone is tiny. As we get older, I can't blow that up and just do it efficiently. It's just easier to have the paper.
Exactly. And I love the advice, because I think the medical notebook, isn't just something for Special Olympics athletes to use. Like I think I'm going to actually go end up making one with a 3-ring binder and keeping all of my past medical records in it as well, because it's so much more helpful. And then, like we said, when you're sick, and if you need to go to the emergency room and you're sick and you're lying on the bed and you can't really speak, or you can't really, think clearly because you've got something going on inside you, just being able to say, here's my notebook with all of your updated information will make it super simple. So, all right, you guys got any more questions for Dr. Gaffney? I think that's it, Dr. Gaffney. Thank you so much for coming out today. Thank you so much for being a part of our virtual health and fitness and providing such great health education for our athletes. I'm sure we've got athletes watching on Facebook Live right now. And then also I had a couple athletes tell me they couldn't make it today because Memorial Day weekend's coming up and they've got family in town and stuff like that. So they're going to watch the recording later. So thank you so much. And athletes, turn yourselves off mute. Let's give Dr. Gaffney a big thank you before she goes. Are you guys ready? 1, 2, 3.
Thank
you.
Sure. And you
Awesome.
know what, Jesse, if people have any kind of follow-up questions, you can kind of gather those and email me, and then I can shoot you some information back. Okay.
Perfect. Will do. And then
Dr.
athletes, yep,
Lola,
I'll send you the
Yes.
slides.
have
Wait,
you ever
somebody-
understand anxiety before?
Have I ever understood anxiety before? Sure, a lot of people have anxiety.
I have anxiety of driving. My heart
Yeah.
will never stop racing. It's like when
Oh,
I get
man, I'm with
permission to
you, Luke.
drive. I tried
I'm
that
the
once
same.
5 years ago with my dad, and I lost it. My heart
Yeah.
lost its trust to drive it. I have
Yeah.
anxiety for a year now before I got jealous that my little sister drives.
Oh, okay. Yeah, I got my heart racing.
Okay. Well, thank you all, and I'm going to sign off. But if you have any other questions, then Jesse can email me, and we can go from there. Okay.
Sounds
Mhm.
good. Thank you
you.
guys so
Thank you,
much. We'll see you
doctor.
All
later.
right.
Thank
Thank you.
Bye.
Bye bye.
Bye, Jesse. Bye, everyone.
See ya.
All right.